BC is facing a toxic drug crisis. In May and June of this year, an average of 4 people were dying from toxic drug poisonings every single day. But learning how you can help in the event of a toxic drug poisoning can help save a life. This is what to expect responding to a toxic drug poisoning. All right, we're in downtown Surrey. It's one of the cities in BC with the highest rate of toxic drug poisoning deaths. And in this video, we're going to learn step by step how to respond in case we ever encounter someone who's experiencing a toxic drug poisoning. But first, let's meet with Cody. He's a harm reduction lead at Fraser Health, and he's going to give us a bit more context around the current crisis. Hey, Cody.
Hi, Joel. How are you?
Good. Thanks so much for meeting me.
Of course.
Okay, so we are in the midst of a toxic drug crisis. Can you just take me through what does that actually mean? What's happening?
Yeah, so we're continuing to see an increasingly toxic drug supply, leading to people losing their lives. Toxic drug poisoning itself is actually the leading cause of death for people aged 10 to 59 here in BC.
So who is the toxic drug crisis affecting?
Yeah, I think we often think that it's about the people over there who are impacted, not the people who are closest to us, right? But anyone can be impacted. We have working professionals, we have parents, we have youth as well.
So why is it important that we as a community learn how we can help in case we ever come across someone who is experiencing something?
You know, help doesn't always mean responding yourself, right? Help could be calling 911. Help could be sitting with the person afterwards and really walking them through what happened. But the intervention is the important part. Being able to identify toxic drug poisoning and being able to intervene can save a life.
So where does toxic drug response fit along that continuum of care?
Response is just a piece of a much larger picture. At Fraser Health, we also focus on harm reduction supports. We focus on treatment. We focus on cultural safety. At the end of the day, response is about keeping someone alive so that they have the opportunity to take the next steps, whatever that would look like for them.
So now we're actually going to meet with Edward, a social worker with Fraser Health's overdose outreach team. Okay, so you are going to take us through some of the steps on how we can respond to a toxic drug poisoning. Who should be learning this, though?
Everyone should be learning, Joel.
Can you sort of take me through how I would recognize that someone has actually experienced a toxic drug poisoning?
So typically we like to go through the save me steps. You're going to want to approach them a little bit of cautious. You'd be like, hey there, are you all right? I'm coming over. I'm just checking to make sure that you're feeling all right. Let's say they're not responding to any verbal stimuli. We're going to start looking for physical stimuli. So some of the things we can do is check for the discoloration of their nails. Is their skin looking clammy? Do they have altered breathing? Some physical stimuli you can also do is say, always remember to ask like, hey, I'm going to just rub your knuckles. You notice there's no physical response. And another thing we recommend, you can squeeze their traps to see if you can elicit a response. Because if they're not making any noise despite all that, they might be having a toxic drug event. So we're gonna check if they are breathing. We're seeing that Cody's chest isn't rising normally. So the next thing we're gonna do is we're gonna check for their pulse. You can check for the pulse in the neck, or the other way is you can check their pulse through their wrist. You can check them out to see if there's anything. You're just gonna want to lift the head a little bit, support it, and then you're gonna just tilt the chin. That way you can see in the mouth, nope, there's nothing obstructing it. If you're comfortable, we ask people if they're wanting to give one breath every 5 seconds. And you wanna keep giving breaths until breathing is normally. So we're gonna check for breathing again, has he started breathing? If there's no changes, then we're gonna check for responsiveness. Like, hey, you're gonna try the verbal stimuli, you're gonna try to check for a pulse. This is where we're going to get out our Naloxone kit.
So what is Naloxone? We hear about this all the time with the toxic drug crisis.
Naloxone is a medication that can reverse the effects of opioids. Opioids have the ability to depress or lower the respiratory system. So that means it lowers their heart rate, it lowers their breathing, and in some scenarios can even stop it completely.
Using the included syringe, Edward withdraws the naloxone and applies it to the thigh or the upper arm, pushing it down firmly until the needle retracts. How quickly would I expect to see a difference in him?
Usually you can expect a difference within a couple of minutes, I would say. So we're going to keep giving those breaths one breath every 5 seconds. We're gonna check breathing again.
If they're still not breathing normally 3 minutes after receiving naloxone, Edward says to give them a second dose. He starts to regain consciousness. How will he be feeling? What would that look like?
Everyone can have a different response, but some things typically happen is they might feel confused, be warm, be sort of gentle. Like, how would you want to be treated, right? Like, hey, you've had a toxic drug event, I provided you some naloxone, and the paramedics are coming underway. It's really important we have someone monitor them, or they go to the hospital if they're feeling comfortable with that, because the effects of naloxone only last for 30 minutes for 2 hours. And after that duration, they're at risk of having another toxic drug event.
If people see this and they want to learn more, they want to get some training even, where can they go?
This is just to give you an idea of what maybe a response would look like in the real world. If you want to learn more about responding to a toxic drug poisoning, you could go to towardtheheart.com, you could go to fraserhealth.ca, or you could reach out to a local community organization who distributes naloxone.